Hey everybody, this is a quick overview of a little thing I like to call the medical handshake. We've always been taught that the best way to introduce ourselves to somebody and to greet somebody is with a handshake. So you shake hands. While shaking hands, you're making direct eye contact, you present with a smile, give off good body mechanics so you're not coming off as rough and gruff, just open and kind. So the same thing will apply to greeting patients in the world of EMS. You greet them with a handshake, a smile, good body gestures to present them and welcome them. Those are some basic soft skills that possibly some of the younger generations are lacking. A formal handshake has been pretty consistent over the years of what it consists of, but there are some variations to a handshake.
This is why we're here.
Yeah, I think Murph, I think we just got to demonstrate.
All right. Might want to take notes. This first one's called the Jenga.
Let's get right into it.
Here we go.
You go ahead.
I'm going to add a block. There's
Hello.
a block. There's a block. There's
Hello.
a block. Hello. What's going to happen?
Ooh.
Oh,
It's getting a little
I have one more block. I have one more. One more?
Whoa!
The Jenga. All right, next up, Coach.
I think we're going Gossip Queen. Now.
Gossip Queen.
You ready?
What?
Gossip.
Gossip Queen. This is one of our more sophisticated ones. The prom. Slap hands. Maintain a nice firm grip on the hips and pose. It's just a nice feeling between you and your teammate. You might want to take a picture. This is a memory that'll last a lifetime. All right.
Yo, shouldn't we be getting back on defense?
Oh my God.
Defense. Is that your cousin Damar? This next one here, a little on the controversial side, but this one's called Black Dad. You're gonna want to slap hands, and you're right at the grill.
Right at the
with
grill.
It. What's up, brother? How you
Hey,
doing?
how you doing, bro?
Man, you know, just came back from Memphis, Tennessee, visited the
Okay.
family, baby. You know.
Did you ever hear from Tyrone?
Oh man, you know, come on, man. You know
Yeah.
Tyrone ain't got no minutes on his phone.
That's right.
That's right. All right. So it's something like that. That's pretty much.
Make it your own. Do whatever you want to do. Those are just some suggestions.
The handshake we'll discuss is the medical handshake. You shake hands with that patient as you greet them. With your other hand, you begin feeling for a radial pulse. This way you're checking the circulation, those C's, within your primary assessment of your patient. While checking that radial pulse, you're checking the perfusion status of your patient. So right away, grabbing that skin, you're able to tell the temperature of the patient. Are they cool? Are they warm? Also the other conditions, is it dry? Are they clammy? Are they diaphoretic? In checking that pulse, first step is checking to make sure that is there a presence of a pulse? What is the rate? Is it fast, slow, normal? Not trying to count the rate, just checking and getting that middle note if it's fast, slow, abnormal. The rhythm, is it regular, irregular? Does that pulse rate carry a consistent beat and a consistent tempo? And the quality, is it strong? Pushing hard on that pulse, do you still feel it bounding the whole time? Is it weak? Do you have a hard time trying to find that pulse? Do you barely feel anything palpating? Or is it thready, to where you feel a pulse but just slight pressure takes that pulse away? Then we're going and looking at the pupils. So we're shaking their hand and we're looking directly in the eyes because, well, that's the proper thing to do in a handshake. So we're looking them in the eyes. So with those eyes, we're looking at those pupils. Are they normally sized? Are they dilated? Are they constricted? And we're looking at the collars, not whether they got blue eyes, brown eyes, whatever, but we're looking in the whites of their eyes. Are they white and shiny and glossy? Or are they yellowed and jaundiced? Or are they dull and lack a luster, such as in our pediatric patients? So checking in these eyes can tell you a whole lot about your patient. As some of the hippie generation said, the eyes are the gateway to the soul. Well, looking in the patient's eyes can tell you a significant amount about that patient. When looking at those pupil sizes, take note of what the light is around you, because if there's a whole lot of light, those pupils are going to constrict. So that might be why a patient has constricted pupils, because, well, they're looking directly into a bright light or a room that is very well lit. Or if the room's kind of dark, it could cause those dilated pupils. Otherwise, if a light is normal but the pupils don't match what the light is, you need to begin thinking of wow, this patient who's short of breath and I'm looking in the eyes and her pupils are dilated, I can tell right away this patient is probably hypoxic because, well, hypoxia causes pupil dilation. Also, if you're feeling that pulse and you feel it beating extremely fast and that patient is very anxious, slightly irritated, maybe they're on a stimulant drug that causes pupil dilation. Or if a patient's weak, very lethargic, and they've got those constricted pupils, well, maybe grandma hasn't taken her fentanyl patch off before she put on her next one. If you're looking in these eyes of the patient, looking at the colors, looking into, say, a pediatric patient's eyes, and her whites of their eyes are very dull, let you know that this patient is probably not perfusing well, is probably in a near state of hypovolemic shock, they're dehydrated. If you're looking at this patient who's kind of warm and you're looking in their eyes and they're yellowed, this patient's probably in renal failure and jaundiced. But if they're white and bright and you got a good firm handshake, a good regular strong pulse, skin's pink, warm, dry, let you know real quick in his primary assessments that maybe this is just a stay and play patient, maybe it's not a load and go. So as an overview, when you're doing that medical handshake, what are you gathering out of that? What do the pulses tell you? So how's that patient perfusing? Hoping that they do have a pulse, for one, but rate, rhythm, quality, what's that tell you about that patient? How does that relate to their symptom of their complaint? How does their skin condition and temperature relate to everything in your assessment? What do the eyes tell you? With their oxygenation and perfusion, what is that pupil size telling you? Does that also relate to a symptom or complaint? Or how does that tie into their current mental state? So using that medical handshake as part of assessing your circulation and part of your airway and breathing too in that primary assessment can help in determining that patient priority. So if you go up to this patient and you do a handshake and you feel a really slow, really weak pulse, and this patient's having syncopal episodes, that might just trigger you right away to say, hey, this patient's bradycardic and possibly hypotensive, possibly this is why they're having a syncopal episode. Or if this patient's having crushing chest pains and you shake their hand, you feel a pulse and you feel a very strong, extremely rapid pulse, you probably know that this crazy fast heart rate leads into their primary complaint of that chest pain. Or if this patient is having those syncopal episodes too and you go to shake their hand and there's no palpable pulse and they are cool and clammy, it'll let you know too that they have a terrible perfusion state. So in the BLS and ALS worlds, this helps let you know about determining that patient priority. So even in the BLS world, right away you go up, you feel issues with or perfusion status, can tell you right away that maybe you need a call for medic right now. In the paramedic world, let you know that, hey, this could be a load and go patient, or we got to intervene with things promptly, or even we need more help. So go into all your patients, make contact, do a handshake to all your patients just because that's the polite, proper, and right thing to do.